So there are a few extra tests that we do for the lumbar spine when we don't get all our information from the basic functional examination. The first test is called the slump test, which is a very sensitive test for primary disc-related disorders. Might also be helpful in the interpretation of secondary disc-related disorders. We ask the patient to sit straight with the hands behind the back. And then I'll first show the slump with proximal initiation. We first ask the patient just to flex the head and the neck, and then flex the spine while keeping the sacrum vertical. So you don't want the sacrum to move. The sacrum is vertical. We ask any change in the pain. In that position, you grab the heel and the plantar aspect of the foot, dorsiflex the ankle, then raise up the leg until you feel resistance or pain. Then in that position, we ask the patient, the therapist will move the hand from the lumbar spine that keeps the sacrum vertical to the cervical-thoracic junction around C7T1 to avoid any trunk movement, and then asking the patient to raise up the hand and asking if this makes any change in the pain of the patient. The test would then be done on the contralateral side. And then if that doesn't give you the answer, you can also do a slump with distal initiation. So the patient is sitting straight. You hold the heel and the plantar aspect of the foot, dorsiflex the ankle, raise up the leg until you feel resistance or pain. The patient asks you to stop. And then you ask the patient just to flex the head and the neck, flexing the trunk, slouching while keeping sacrum vertical. And then in that position, you release the dorsiflexion and check if that changed the pain of the patient.